expect a rise in malaria cases over the Easter holidays as a result of people travelling into higher risk areas. Now, the areas on high alert are the northern parts of South Africa, such as the Mopani and Vhembe district in Limpopo Province, and the western parts of the Waterberg District, such as Thabazimbi and Lephalala areas. And people travelling to the Mpumalanga Province, including the Kruger National Park and the northern parts of KwaZulu-Natal towards the border of Mozambique, should also take precautions. And joining us this morning is Professor Lucille Blumberg from the National Institute of Communicable Diseases. A very good morning to you, Professor, and welcome.
Thank you very much.
As I've mentioned, we see that all the areas that are on high alert are particularly close to the borders of South Africa. Why is this the case?
Well, I think they're low-felt areas. They experience the right rainfall, humidity, temperature to support the development of the mosquito, the parasite. And there is cross-border travel of mosquitoes, people. And actually Mozambique is the highest risk area for travel now for malaria.
So do you often see an increase in malaria infections, particularly during this time of the year?
Yeah, we see them over Christmas, over New Year, when many people travel to malaria areas, and particularly March, April, where we're actually at the peak of the season.
Now, who is most susceptible to malaria infections?
Actually, anybody. Some people think they're not bitten by mosquitoes, but you don't always have to see a mosquito bite. Some people do attract mosquitoes more, but actually everybody's at risk of malaria. And everyone in South Africa is actually at risk of severe and complicated malaria if it's not treated early.
And how do we protect ourselves?
Well, I think that's what travellers need to do now. So protect against mosquito bites. If you don't get bitten, you may not get malaria. So use insect repellent, and many available, even in supermarkets, those containing DEET, applied to exposed areas when the sun goes down. That's when the mosquitoes are most active. Wear long pants. If there's a fan, air conditioning, screens on the windows, use those. And I think if you're going over the border to Mozambique, where there's a lot of malaria, you may want to consider medication to prevent malaria.
And I suppose one of the many mistakes that we make is that if I've got malaria, or I get the malaria symptoms such as headache, fever, I presume that I've got flu, and I take flu medication. That is instead of malaria medication.
Yeah, that is the biggest mistake. If you look back,
people get killed as a result of it.
If you look back at people who died from malaria, it was often a misdiagnosis by themselves or sometimes a health practitioner that they had flu. So I think the key message is, if you live or you've travelled to a malaria risk area and you develop a fever 10 days or so after travel, or slightly longer, or what you think is flu, and you describe the symptoms perfectly, you must urgently get a malaria test. It's very treatable, but it's rapidly progressive over 2 or 3 days, and complicated malaria is difficult to treat. So treat early, inform your health practitioner that you've travelled, demand a malaria test, and don't become a victim.
And apart from the usual symptoms of headache and fever, what are some of the symptoms?
So it's really quite sudden onset. Fever is the most consistent. Cold shivers, hot sweats, muscle pain. Children, it's a little different. Fever, they don't eat very well, they may vomit. They don't have the classical cold shivers, hot sweats. There's no flu around at the moment. If you have flu-like symptoms, travelled, live in a malaria area, you must have a malaria test. And get treated quickly. It's absolutely treatable. We have excellent drugs, state-of-the-art drugs, but you've got to treat it on day 1 or 2, or you may be in trouble. We can treat complicated malaria, but it's much harder.
You also mentioned that it's as a result of the widespread rainfall. Can you elaborate on that? Well,
you know, the mosquitoes that transmit malaria, the parasites that are the cause of malaria, are very temperature dependent. They need humidity to develop, and the mosquitoes obviously need water. When there's lots of rain, they may get washed away, but otherwise they breed even in footprints quite quickly. We're actually in a better shape this year than last year. A lot of interventions by the malaria control program. Perhaps it's just a little cooler, but this is the high-risk season, and don't become a victim.
So even in non-humid areas, I can still get malaria?
Well, we have no malaria in high-veld here. We have the occasional mosquito that hops a lift. That's quite unusual. But they do require humidity, certain temperature, and obviously water to develop.
Yeah, which brings me to my next question. Is there a particular breed of mosquitoes that causes malaria, or any mosquito can cause malaria?
No, so it's the Anopheles mosquito, and they're different species. It's not the Culex mosquito, that nuisance mosquito that you hear buzzing in your bedroom in Johannesburg at night.
Thank heavens.
That you do this and it continues to buzz. These mosquitoes are found in specific areas. We do a lot to control them. Malaria areas, they spray the inside of houses, but many mosquitoes bite outside when you're enjoying your braaivleis or social times in the evening till sunrise, not during the day.
So after being bitten by this particular mosquito, how long does it take for malaria to start, taking effect in our body?
So not every mosquito is infected. If that mosquito has a parasite, it will go into the blood and the liver and then into the blood, and it takes on average about 10 to 21 days.
Okay.
So that period after people have travelled, very important to watch out for flu-like symptoms, demand a malaria test, get the result, and if it's positive, start treatment early.
So even if it's a late diagnosis, I can still be cured? Really?
So late diagnosis is more of a problem. Malaria can affect the brain, the kidneys, the heart. It's really multi-system disease. We do have drugs. We actually have better ones, but the chances of survival are much less. Almost 100% treatable if it's picked up on the first day or two.
All right. Professor, thanks for that.
Thank you very much.
All right, that was Professor Lucille Blumberg from the National Institute for Communicable Diseases speaking to us in our Johannesburg studios. All right, it is 19 minutes before 9 o'clock. Let's go for an ad break now.